and welcome to News 9. I'm Pratibha, and in today's show we are going to talk about how Karnataka has been affected by COVID-19, the common myths, and what you can do to ensure the spread of COVID-19 can be halted completely. The COVID-19 numbers continue to soar and questions keep mounting. Who's getting sick? Who is most vulnerable, and when will life go back to normal? We'll answer all of those questions and other coronavirus related questions. We are joined in by Dr. Vivek Jawali, the Director for Cardiothoracic and Vascular Surgery, Fortis Hospital, for practical advice about how to protect yourself and your family during these unpredictable times. Start with a question. Firstly, let's focus on Karnataka. Our focus remains what's the situation like in Karnataka. So far, Karnataka has reported 3 deaths due to the novel coronavirus. So where does Karnataka stand as of now? How serious is the situation in the state?
See, the numbers may look benign. We have crossed 50s, but slowly we are creeping, and we are creeping faster. We have had 3 deaths, but out of these deaths, people who died are elderly people. They had comorbidities. But you have to understand that globally, the numbers are running amok. And if you see the richer, more developed, more civilized Western world, which is more well equipped to fight such a thing, the numbers are now very scary. I think today morning when I was talking to my friends from United States, it was evening there, it looks like the Americans are now coming down to their knees. Italy has already lost the battle. And do you know that in Spain, out of all these deaths that have happened, in Spain, more people than China have died. 40% of the deaths in Spain have been that of healthcare workers, doctors, nurses and technicians. So this is not to be taken so simply. Today we may be not seeing big numbers, but it's just a matter of days. And it looks like now this week for Karnataka and for India could be an inflection point. And what the Prime Minister and the government has been warning us, that social distancing and social distancing. We have been very lucky, and God has blessed us that He has not made us a bakra like all these countries, and He has given us a time to wake up. If we can use that God's blessing, wake up in time, listen to the Prime Minister, shut up and go indoors, we may be spared. We may have a very low amount of people suffering, and the amount of people suffering or getting serious, requiring ventilator, etc., will be within the reach of our healthcare capacity. If there is a line of healthcare capacity and our curve starts going above that, then God only save us. There will be a bio-correction of India. So don't take it easy. And right now, what is our capacity is very small. So our God's blessing is, if you are smart, if you get afraid, and if you stay isolated inside your house, your blow may be softer.
Okay.
That's all is in our hand. Whatever we are talking about is hydroxychloroquine, chloroquine, azithromycin, that antiviral drug, this antiviral drug. No drug works on this corona. What will work is prevention. And especially the elderly people who have got diabetes, hypertension, they are above 65. Younger people like fools will gather this coronavirus, bring it in the house and kill their elderly parents, grandparents, in-laws, uncles and aunties. Be very careful.
That's the biggest fear, isn't it, doctor? That, there might be youngsters who might not be feeling the symptoms yet, but they might still be carriers and they might be passing it on to others.
It takes anywhere from 2 to 14 days of a period with the coronavirus inside you and no symptoms. And in this period, you will go all over. I'll tell you, the worst example has been set by our own state, Karnataka. And media has just kept quiet about it. The first death of this country happened in Gulbarga. The elderly Maulana came back from Makkah. He had carried virus. He was sick. He had a flu. And in Gulbarga, he was admitted in a private hospital. The health authorities were informed. The district health authorities came. They took his swab. They took his samples. It takes 2-3 days for the samples to come. Maulana was getting more and more sicker. Mr. Siddiqui, and then the crowd gathered as usual in front of the hospital, and the people started getting scared, the doctors and nurses. They informed the health authorities. The health authorities have to be very firm, inform the police and not allow unnecessary any appeasement. But then they just kept quiet. This patient was taken to Hyderabad all the way. He had exposure in Bangalore to people, then in Gulbarga, then he goes to Hyderabad, stopping for tea, etc., all the way to Hyderabad. In Hyderabad, they changed 3 hospitals. They were sternly told that the isolation center was at the Gandhi hospital. He has to be admitted in Gandhi. Because of the crowd, people kept quiet. They refused and they came back to Gulbarga and he died on the way. Do you know now they are tracing more than 4,000 people who could have been contracted. We have no ideas because what tests we do, they take time. There is a feeling that 30% times the test may come falsely negative. We still want better testing. So this is not as simple. We have no treatment and we don't have perfect test, and the test result take a long time.
We'll come to the issue of tests as well, because that's the one criticism as India has faced as well. We'll come to that later. But also, Doctor, talking about the situation in Karnataka, the Deputy Chief Minister Ashwath Narayan had said that the numbers in Karnataka are expected to scale above 1 lakh. That's what he said. So how seriously should people take this doomsday theory, and what is your plea to the people of Karnataka?
Listen, Pratibha, I'll tell you one thing. We all heard that Devi had told that Imperial College paper where they were expecting 12 lakh deaths in USA, 5 lakh in UK and 35 lakh in India. We thought it was exaggeration. Today is 25th. The John Hopkins Institute of Epidemiology has released a publication. They are extremely scholarly epidemiologists, and they have done a detailed study on India state-wise. And if you look at their charts, this is time scale and this is the numbers of the patients suffering. The numbers they have written in lakhs, it's not in thousands. So that is very scary, and it is coming from academicians like those in John Hopkins. So we have to be very careful. But again I say that we have something behind us, the blessing of the God, that He is still sparing us, giving us opportunity. Let us not be foolish. Let us not be caught into all kind of myths and WhatsApps. We are not safe. Go inside the house. God has given us the chance for social distancing. We can break the chain. We can still make our numbers very less, and our healthcare capacity can still manage us.
Right.
But otherwise, there will be a huge life and economic cost to pay for this. This will be a big destruction. So now, don't even fight with the police. Understand, those who have to go out, those who are in essential services, police have given them all passes. Use the passes. Other people just keep quiet. Lot of people, just because it's like a holiday, they are getting together, having big meals, all kind of gatherings. Don't do that. Have a distance of at least a meter, 2 meters from each other. Sleep in different beds. Be very clean and don't waste water. You know, take a little water, then nicely do the soaping of the hand, then take a little water and finish it off. Everybody is running the tap for 20-30 seconds. Don't even do that. The summer is going to come now. So be careful. Keep wiping with sanitization your surfaces of the doorknobs, your mobile phones, your switches, your everything. Keep things clean and neat. Whatever clothes, papers, etc. You can just keep such a hot sunlight. Put them in the balcony in the sunlight. Everything. The virus is a very fragile, non-alive particle. It has a small coat of fat over it. The fat can very easily melt with heat, with soap, alkali, with alcohol in the sanitizers. But we have to be careful.
Right. Doctor, so you spoke about why this lockdown is so important. The 21-day nationwide lockdown gives India an opportunity like no other to flatten the new coronavirus curve, especially if widespread testing is carried out during this period. But the question is this lockdown enough to flatten the curve, or is there much more that needs to be done?
No, this is not alone. We have to go multi-pronged, machine gun approach. A, to reduce the force of the blow, lockdown, strict lockdown and cleanliness. Number 2, we know that this will reduce the blow, but there will be patients who will be affected by corona, of whom some will become serious, Our hospitals will be flooded, our capacity will be stretched to its capacity, and it may even tear. So our capacity has to be built. The government cannot be keeping quiet. This is a war-like situation. In a war, it's a very fluid situation. You don't know what is going to happen. So the most important rule number one in military is the command structure has to be very strict and nobody has to wag their tail. What is Karnataka's command structure? Who is the boss? And under the boss, we have to have the heads of everything, the supply chain, the ICUs, the pulmonology, the anesthesia, the PR communication, the finance, the HR, and the transport and everything. We have to have a very command, and there is no secrecy here now, unlike a war. So we can be very transparent about this command. We have a great private sector behind the government. There are fantastic managers in these private structures where the supply chain management, the HR management, the finance management, PR management, they can do a great job. There are fantastic intensive care specialists. What all private can do for government? Government may ask what all private can do. I had actually made a list before this program started that what private can do. All the hospitals can run flu clinics. So these patients can go all to these flu clinics and not gather into one government center. And from that flu clinic there could be vehicles, there could be ways of testing, etc. Number two, we can allow testing to be done at all these private laboratories. We have to fatafat get lot of kits, and we are under testing. More and more we test, we will catch the people who can spread the virus and lock them up. If we don't test too much, then, because in the beginning we were conservative, but now things are at the inflection point. So we better test and catch everybody who is positive and lock him in. Second, thirdly, the PR activity, public awareness, education of public. All these private hospitals have got great branding departments, PR departments, and they can partner with the PR companies and can educate the public within 2-3 days or whatever we want. Also training. We have to have a huge army of the junior doctors. All the junior doctors have gone their home holidays. They have to be recalled, they have to be trained. The training, a large lion's share of the training can be taken care by the private hospitals. Then the isolation beds. If this government facility starts spilling, then the private hospitals can give you isolation beds. Then the private can give you manpower cover. The manpower cover, yesterday Nirmala Sitaraman has declared a 50 lakh insurance cover for the government medics. If the private medics chip in, even some arrangement have to be done for them. They can't be just hapless scapegoats. They also have to be covered by insurance. And then equipment. Equipment can come from private, but it cannot come in the hands of novices who would spoil all the equipment, and tomorrow neither government will have, private will have. So along with the equipment from private, the mothers and fathers of this equipment, the expert manpower has to come and take charge of those equipments. And also creating our supplies, creating all the know-how about how do you use one ventilator for 4 patients. Where are the splitters? Where are those factories? Where are those 3D printers who can create these tubings? And those transparent covers on the patient head where they can stop the aerosol spray, and the suctions which can take away the aerosol. All kind of small nitty-gritties, but better quickly have our capacity built properly before the blow comes, and show what is your command structure. We have a war room, nice, good, looks very impressive, but better to have a command. Everybody talk to me, talk to Devi Shetty, talk to Naresh Trehan. We are cardiac surgeons. We are not the professionals in public health expertise, pulmonology, intensive care, or the government management. There are many IPS officers who are quite good in healthcare management, but this is what I call as the command structure. And you have to give us the war plan. What is your war script? What's your plan A, plan B, plan C? Unless you are crystal clear, A, you will spoil the God's opportunity to be prepared. And B, if you wake up late, you will be caught unaware by the enemy, and soon, like Italy, you would run out of bullets. Italy has too many bullets for that small population. for a big population 1.3 billion, we have less bullets. So we have to be very, very planned.
You know, while speaking of South Korea, they have said that only 1% of those who have been tested have turned positive, which also shows the extent of tests that have been conducted. So the Karnataka government's plan is to randomly test 25,000 people per 2 weeks. Do you think this is the way forward? 25,000 people per 2 weeks. How feasible would that be?
Time has come. Time has come, Pratibha. Test, test, test.
So would that be feasible? When the Karnataka government says that random tests would be conducted, how would that be done? How do you say that should be done? First, by tracing those who have been in contact
feasible
or in the vicinity of those who have tested positive?
Adequate kits. Feasible if we have adequate kits. I have no idea what is our capacity, what is our supply.
Okay.
And we have to also spread our legs as long as our blanket is. But so we have to have a very clear idea what is our capacity. But as a principle, test, test, test.
Vivek, there's a perception that people with underlying health problems are most at risk. Is that correct? And you know, how deadly would those with underlying symptoms?
Yes.
So they are more susceptible.
These people have a high chance of getting the pneumonia. If the pneumonia happens, 50% of the lung get fibrosed. Anybody in a country like ours gets onto the ventilator, that's serious. He has a chance between 80 to 90% of dying. They better not reach there. And this happens mostly to elderlies who have diabetes, who have heart disease, who have kidney disease, who have comorbidities.
Okay.
And they will stretch our Indian capacity to its seams and tear.
Doctor, an additional question there is for pregnant women and even for others who have other illnesses as of now. How safe is it to go to the hospitals? Because that's also a concern that many have put forward. Is it safe to go to hospitals right now? Good
question. Good question. You know, last 3-4 days, I have been debating with my old classmate who is the Karnataka Medical Council chairman. He is a caretaker chairman, that telemedicine. The Indian Medical Council also has been debating on that. Yesterday, they released the letter. And the answer is telemedicine, telemedicine. Telemedicine has been around. Online consultation has been around for so long. But we have taken a long bureaucratic time to come to terms with us. Our judiciary also has not been very open-minded, very proactive. And we have been all the time putting obstacles in its way. Now this thappad has come and we have woken up. We cannot allow our elderlies to come to the hospital. The simplest thing now, we have already Manipal Hospital, Narayana, everybody, all these hospitals will be seeing that they will be putting up messages, what is the number and how do you get onto online consultations. And there are so many companies like, in Bangalore who are also doing this work for the hospitals. And online consultation will dramatically see the numbers of elderly people coming out of the house for medical. Online we can screen you, we can understand from your symptoms. We don't have to really touch and feel and make out what is happening. We can gather most of the picture from your online consultation, and only if it's really required, then we can get you over, test you over, admit you, and so on and so forth.
Okay, so online consultations for now. All right, doctor,
today for telemedicine online, we are getting now queries from small cities of Karnataka. And we are getting queries, we are getting online consultation calls at 3 a.m. in the night, 11 a.m. in the night. And all these companies like Practo, they are all now very well geared. Slowly we are seeing that the numbers are going up and up. But now with the Medical Council giving it a complete open go, now there will be an explosion on online consultations.
But the general feeling is that unless the doctor sees you in person, they would not be able to find out what is wrong exactly, or they might not be able to effectively treat you. You're saying that's not correct.
I think he thinks, what is the meaning of that? There is no meaning. Just listen and follow.
Okay, doctor, there are several people as well who have spoken of traditional Indian medicine, not combating COVID-19 per se, but any symptoms, early symptoms that you might have, you can combat it with the traditional Indian medicines that we've known all these years. Would that be correct? And if somebody has slight symptoms, is it okay for them to take medicine?
Pratibha Bada, not in the war time. No, nothing unproven, no social media gossips in a war time.
Okay.
If
Best
you have
avoid it
flu-like symptom, urgently report. Don't sit in the house and my Ajji told and my Ajja told, and don't do that. You will harm yourself. That is a small problem. You will
will also harm
your
others.
whole family.
Dr. Vivek, we were speaking about the kind of measures that are being taken. While you spoke of how the viruses stay in certain objects for a certain number of time, there are still people who are going out for essential services, for supermarkets. They're stepping out, and there as well, there are several items that are put up. You're still touching them, bringing them home. Would that put you at risk? This is a question that several people have been wondering. The viruses stay in objects for a long time.
Yes.
There are several people who are visiting
Yes.
supermarkets. So how susceptible are they?
Yes. Yes, the objects that you take out, the objects that you bring in, try and see how much you can clean. And simple things like putting them in hot sunlight in your balcony for some time also can be a very good solution. And whatever sanitization possible, to what extent, try and do that. But make sure that the percentage of alcohol is high. Those are very dangerous things actually, and as much as possible you have to isolate. Very difficult to guarantee something 100%.
While speaking of the medical staff being infected perhaps and the onset of stage 3, there is also talk on whether volunteers should be called in now from, across the country, volunteers who can now be trained.
They will be called in.
Who can be trained now as the situation worsens, so that they are prepared until then to tackle with the situation. Do you think that's a possibility at all? Should that be done?
Absolutely. Yes, yes, yes. We have to divide all these works. Some people will be training the volunteers. Some people will be training junior doctors. Lot of people are volunteering. We are getting messages, mails, phone calls. People who are ready to volunteer. People who are highly educated. People are from very higher class of society. A lot of people have heart. Everybody is ready to volunteer.
Yeah.
And you are right. Actually, training has to begin. That is why I said war plan. We have to be very crystal clear on war plan, and everybody cannot be the commander, so there has to be a command structure, and the command structure have to be very transparent and give orders and utilize all the things, whatever they can get from the society, from the private sector, from the voluntary sector, from the NGOs, from the people who are trying to volunteer. We have created one medical college per district. How much workforce we have created, how many juniors are there, how many staff members are there. We have to galvanize all this in action. One medical college per district we have now.
What is the end of this pandemic? Can it happen that, the countries around the world take their measures and one day it comes to an absolute end, or will it continue to exist but the mortality rate will come down drastically, or would a vaccine be created? What is the end of what we're seeing right now?
See, this is not the first time world has seen pandemics. We are at least better off, more affluent, more knowledged, more technically savvy. So there have been pandemics. They have killed millions of people in the past. Humanity has survived. We will survive. But we have to learn some lessons from this. Forget about the world, about India. What have we been doing for the last 70 years? We have wasted time. We have not really taken our healthcare management seriously. Government side, the government centers, 1.5% GDP we are spending, and that too is so much lost in corruption. We have not created a great government infrastructure. There has been a fantastic private infrastructure that was created. We are now putting lead balls in their legs. They are on their pricing, and they have to be answerable to hundreds of regulators who are corrupt. So we are not, and in 1947, till then, the East India Company had IMS, Indian Medical Service, like the IAS, IPS, IRS. They had done a great job till 1947. Plague, cholera, malaria, you go back and see that every time the Indian IMS, half them white, half them brown. What great things they have done. And this Pandemic Act that the police is now bringing in, it was written in 1896 by whom? By IMS. In 1943, the Bohr Commission reported what should be the structure for the district, for the taluka. Today also you check the Bohr Commission report for that population of India. It is still ahead for even today's population of India. We just liquidated, finished the IMS for some political reasons, bureaucratic reasons, internal politics in 1947. After we come out of all this faster, we get the Indian Medical Service in place. we will be less groping like this, and the medical healthcare will have something behind it to support in the hierarchy.